So tell me what comes to your mind when you think of analytics. Then we'll come to healthcare. Of course, all of you are from healthcare profession and you have great understanding of it. And many may be working with analytics as well. So what is it about? Anybody? I can check on, I don't want to really. Yeah, go ahead, ma'am. Yes, Dr. Roy, you want Joy or Mahita, Monica, Manas, anybody from your end? No hesitation, please. Please feel free. Because it's a very, very specialized area. It's not a general management area. It involves a lot of it.
Sir, about data.
Okay, about data, right? Kinds of data, right? Great. That's a good, uh, deliberation at least. So what do we do with data? What are the different kinds of data that the hospital actually produce or hospitals produce? What are the different kinds of data that you have? Hospitals do have a lot of data.
Primary data and secondary data, sir.
Yeah, these are the types of data. Good. So can you tell me what is the primary data in the hospital?
That is, we are collecting directly from the patient side.
Yeah. Never ever you have collected this data. You're doing it for the first time and mostly from the patient or from the caregiver. If you are collecting it for the first time, it's a primary data. And what do you do with that data? So you have tons of records of the patient, isn't it? Primary data, if you assemble them over a period of time, can also become secondary data, like the reports. What is the percentage of patients visited for cancer in KIMS in last 1 year? Is this a primary data or secondary data?
Primary data, sir.
Okay. Why not it's a secondary data? Dr. Joy?
Sir, after so many years only we are when we are analyzing and then we are reporting only, it will become secondary data. It's primary we are
Yeah.
collecting. Just collecting it and simply we are recording, sir. So it will be a primary data. When have
Yeah.
some.
Okay. So, all right. I think that's a very good insight. So we can, dwell upon that. We can dwell into deeply and talk about two different kinds of data. Dr. Joy present two data types, right? Primary and secondary. Although this class is not about the types, we will go beyond that because I all started with analytics, right? If you remember, you can also pay attention to the chat. I'm just reproducing what I'm talking so that we'll have great wisdom of knowing it. So primary is the one where you're going to capture the data at that point in time. And if you assemble it, reports of the reports can become secondary data. So when I ask you the percentage of patients in the last 10 years that KIMS have witnessed, then it becomes the secondary data because you have not collected it. It is there. It is lying because it was generated year on year, day after day. And once you assemble that day after day, month on month, year on year data, that will become primary data. So, but what are we doing with that data? So tons of data is there. How many CCTV cameras are there in Hyderabad? Any idea? Just a general question. Anyone? CCTV. Hello. Yes, there is another girl also joined. Srija is around. So, okay, Srija, welcome. We have Mehnaz, we have Monica, we have Dr. Joy, we also have Mahita. So all of them are there, but none of them are speaking. That's an irony. Then we also have Sai. They're all there. Yes. Please speak up. Yes. Tell me. Or is that the format that you want me to dwell into? Is my screen visible otherwise?
Yes, sir.
Yes,
Yes.
so my screen is visible to all of you. That's good. Then let me just straight away go to the screen. Yeah, this is my screen, right? Introduction to Healthcare Analytics. Yes. So I was asking you very small and intimate questions that are related to all of us. And hence it becomes important to know about it. Okay. So what is the difference between statistics and analytics?
Statistic is a simple presentation, sir. Analyzing means interpreting of that data.
Will we interpret in the statistics also? Don't we interpret?
Yes, sir.
We do interpret, right?
Yes, sir.
Yes. So the difference is that statistics is largely at the basic level, whereas analytics will go to the next level. The level from which that you will not just interpret, but you will also take decisions. So the decision making is an important part of the analytics. And healthcare analytics is gaining momentum. Healthcare is an important area where statistics and analytics both are being done. So, do you think it's a good idea to have large equipment in the hospital? How do you take that decision? Whether to have CT scan, whether to have a diagnostic center in the hospital, or can we get it done outside? That is also possible. A lot of small hospitals, they don't have it because they don't want to invest into it. Well, it's going to charge a bomb. It's going to cost a lot. So when are they going to make a decision to have their own diagnostic center inside the hospital? So the patients do not have to go out. The critical care can be taken. This is one very, very small example. Likewise, you can have multiple examples as well. You can have the data related to the patients, related to the diseases. You can classify them. So if there are patients who are coming, how many inpatients and outpatients come every day to KIMS hospital? It's a daily data being generated. All you have to do is to just click the Excel sheet and enter. You get it. So you say that how many people have come today in the neurology department? How many people have come for gastroenterology today? How many of them have come for the lung diseases? So you can generate it through department wise. You can also generate it through the diseases. You can also go into specialization and multiple ways. This gives you a better understanding. So now tell me how many patients actually on an average visit KIMS? What is the footfall of patients in KIMS? Any idea? Hello. Yes,
Around 5 to 6,000.
5 to 6,000. It's a great number. Are they the patients or they are also coming along with only the caregivers or probably the attendants? 5 to 6,000 is a great number. And what about Usmania General Hospital, Gandhi Hospital? These are government hospital. So what do you infer from this information? 5 to 6,000. Then you may be curious to know, oh my God, so many patients are coming. Do we have facilities? What kind of facilities that we are providing them? Is there a seating if they come? How quickly that we are sending them to the respective departments? So they come, they have an appointment, they were immediately sent. How much time does it take for a patient to get his or her diagnosis done and properly done? So it's going to be 3 hours. How much time on an average each patient spends in KIMS? Yes, please. Use this. If yes, how? Please speak up. Don't outsource the talking to me. Yeah, a little louder. Your voice is meek and feeble. Yes, go ahead, gentlemen. Is that Sai who was trying to speak?
So it depends upon the disease they have, no, sir.
It does on an average. You can always take out the average, no?
Maybe 2 hours or 3 hours max.
Okay, great. So 2 to 3 hours is what our friend says. So if you are the MD of the hospital and you want to reduce this time, wherever there are some bottlenecks, wherever there are some ways that you can reduce the time, the waiting period, can the waiting period be reduced? Can we expedite the process? The data is telling you to expedite it. What is the average time taken for a surgery? You say that no, the surgery has to be done in that given time. But what about the setting up of the surgery? What about the free frills that are attached to it? Can we reduce that? So all these things are going to matter a lot. Hence, healthcare analytics is one of the most fascinating fields today. People who hate, dislike data, they will not be able to appreciate healthcare analytics. And it is not frightening, it is not a real threat, it is quite handy. You may like it or not, but the data is generated every day. So as the data is also provided by the WHO, by the Government of India, by the Medical Council, by the Medical Association, by the consortia of the hospitals. All of them are ready to give you the data. What happened to the TB? How many TB patients are there? How many diabetic patients are there in India? Why India is called the diabetic capital of the world today? How did we come to know about it? Because of the data. The WHO agencies have conducted this empirical research, and through that research, you have come to know about these things. So, what are the implications for you as a health professional? So, when you have statistics, when you say that, okay, so if my sugar levels are over and above 120, it's going to 140, and sometimes it's 300, 310, my God, it's in red area. So I'm alert. If my blood pressure is rising. So smaller parameters and measures will tell you a lot about the condition of the patient. And sometimes the number of. So if you want to open a hospital, what is the basic requirement that the medical council asks you? You need to have 300 beds hospital, right? That's a bare minimum. So you may have 500 or plus, but bare minimum is 300. And then you need to have a lot of inpatient and outpatient flow. without which it's very difficult to get a MCI recognition. So you need to have that, and you have to have some specialized services and the flow of patients, all that. So how did they zero it down to 300? And this 300 is not that the beds are lying vacant. You should be able to have patients. The patients are supposed to come, more and more patients, and then you should be able to treat them, and you should send them back healthy. And that's the criteria on which the hospitals need to operate. And people have great respect towards these hospitals. They come with disease, they come with problem, and you are the problem solver. And at various level, you are taking care of the data. At the reception, I think that's the first point of contact between the patient or the attendant and the hospital. It's very, very important that the reception will take the right kind of inputs. The name, age, all these, biographical details that you have about the patient. So all the details that you see, you are generating it, and you are also going to store it. One of the other key important things with the data is the ethical part of it. How do we look into the ethics of it? Okay, so I got some 6,000 patients coming every day. So 6,000 every day on an average into 30 days. So what will be the sum? It's 1,80,000. What am I going to do with this? Can I sell this data to companies? No, it's unethical. I cannot do that. I have to take care of the confidentiality of the medical records. Medical records confidentiality is the utmost care that the hospitals need to take up. That's the contract that they have signed between the hospital and the patient. So you cannot violate it. And violation of this contract might also result into some or the other legal action. There might be imprisonment or heavy penalties as such. Okay, so let's quickly jump into, I'm sure, so this is the introductory class, and as we progress, we will move along. So you may be using your own internal software at times to analyze the data, or sometimes you may be using Excel as well. So the different kinds of in-house, databases are there, and then the different kinds of tools and techniques people generally use it. But in hospitals, there are lots of softwares that are available. You may subscribe to them. Some of them are inbuilt in-house, and some of them are also basically subscribers driven. So you subscribe for a year, you have to pay the AMC charges, and then it goes on. So it makes life easier, and you can connect that with server. You can also have firewalls, so nobody can penetrate into your database. Other hospitals will not have access, because one hospital, because of the competition, can get into you and then try to steal the data. Anything is possible in this world, and healthcare data is so very important. It's like a rich data mine of information. That information should not be leaked. You have to protect in all sense. That is why it's indeed an important thing. Okay, so let me just move on and then talk about it. So when we speak about the healthcare analytics, this semester or this course will provide you an understanding of the healthcare analytics. How are we looking at the fundamental principles? How do we apply them in our day-to-day life, especially in the hospital life? And then sometimes you have to also eradicate these diseases. What has happened to polio, chickenpox, smallpox, or for that matter tuberculosis, and for that matter leprosy, leper India used to conduct, I remember I attended their yearly program, and now that they have stopped conducting, otherwise they used to do it many times. But other national, international bodies are coming and talking about the mental health data, mental health care, not the physical diseases. Physical diseases, I think we have been able to overpower, except the cancer. Even for cancer also, there is a treatment that was found, and you don't really have to go through that chemo and so on. So more and more people will be interested in the analysis part of the healthcare data. That can be at the individual level, at the group level, or at the organizational level, or at the mass level. That is at the micro and micro level. So macro level and micro level, like the whole population of India. How many population percentage in India suffer from malnutrition, malnourishment? Why are we ranked in the sub-Saharan countries or worse than in sub-Saharan countries? So why Sri Lanka, Pakistan, Bangladesh are able to, you know, they also have problems, but they are able to show some better results than us in terms of the malnutrition, despite having a great PWS system. This entire, PDS system, the public distribution system of providing free ration to the people who are from the, you know the below poverty line. So on one hand, so the sociological measures that are being used by the government of India, has it been reached to the beneficiaries? If that is the case, then the malnutrition should come out or should come down. Then for the school children, we have midday meals where we are also going to provide them healthy, nutritious food, where their growing needs are taken care. If that is the case, what is the issue? And then we will also discuss in this semester, in this course, that what are the different challenges and opportunities. And since data in healthcare analytics is not independent, it is interdependent. That's why it's an interdisciplinary field. So you have to get the data from the government, from the society, from different sociological measures, and then you have to also use a technological thing. So nowadays that you won't use. How many of you use calculators? You don't. You just open the Excel sheet and then start inserting the data, or it gets computed automatically. All your softwares are enabled. So when you say that, okay, so there is a GST of 5% on the total bill on the diagnostic test, it is all calculated. You don't have to do it physically, manually, or using your, calculators. It's all driven there, and that's how you will have interdisciplinary nature in the healthcare using the computing technology, and there is a great advancement. Have you heard or anybody tried? Uh, Let me just go back to the chat and then, have you tried this AI chat? Ever use ChatGPT? Hello.
Yes, sir.
So what purpose? Why did you use it?
It is a kind of search engine, and it gives a precise answer. Like, for example, if you go in Google, it gives a lot of options, but in ChatGPT, we get the direct answer straight away.
Yeah, so it works on the LLM model. So there are also models or languages built, and you can just retrieve the data within no time. It's so smart. It understands entire thing, and it gives you throws the results. And these results, even you can ask many of the analytical questions. Now it has gone into giving you the formula as well. You can compute the Excel formula, copy paste that, and then you can run through it. So you won't really have to remember anything. So artificial intelligence in the area of healthcare is growing a lot. You heard of this um, AIG hospitals? Have you been to AIG hospitals? It's there in the news for quite some reasons, or one of you must be working with them. I don't know. But they are the ones who were first employed artificial intelligence enabled services for healthcare, including the operations, including some precise operations. So those brevity, precision, and the kind of accuracy that they want to achieve it by using the technology is immense. It's very, very high and quite enthralling and quite challenging as well, because you have to invest in the technology. So that's the point I was trying to bring in. So let me just quickly go back to the PPT where we left and we move on. So can you imagine healthcare analytics without computing or without computers? It's impossible. Why? Because the kind of innovations that are happening, it's no more just the canvas, it's no more just the data, it's no more just the graphics, it's no more just the way that you're going to present or have the display demonstration of the data. It's not just the visualization of it. How beautifully visualized things that you can see it. It's not just the numbers, but you can also get the pie charts, you can also get those bars, Venn diagrams. All that data is presented in a visual and virtual form, virtually huge visual form. So, like innovations in the computing technology has revolutionized it, undoubtedly. So you just have to open your database and then get into it. 5,000, 6,000 patients coming every day, their data will always be there with them. And once they captured, they will store it. So the databases are becoming richer and richer. And this is just one record of the patient. Like several records are generated. I told you 1,80,000 patients come every month into 12. You can imagine. So on an average, 20 lakh patients that are visiting, coming to get their problem solved. And then if they revisit it, then what are the notes that you have given, the demonstration, all that is being done. That is why it's important to look into all these things. So the role of computing technologies in healthcare is very crucial in terms of innovation. And then there are some analytical reasoning which has changed the way in which information is collected and stored. Can you give one of the examples how this has been changed? How do we use that? What are the ways that we are using it? Information is collected and then there is also the ways of storage as well. So in the server, you will be storing the data so that you can retrieve it. Any idea about it? The second one that I'm referring to, if you're all with me. The whole analytical reasons. Information is no more just collected through paper pencil, a paper pen. Information is also being collected, through databases. You may get the clicks. Do you know that even the number of clicks that patients do will also be taken into consideration? Like I send you an email and this is related to some health insurance. And you say that, okay, health insurance is a subject, I have read it, I'm not going to open it. So as a sender, I can have an application and that application will tell me if I have sent this email to 10,000 people, out of 10,000 people, how many of them have clicked it? Clicked. Just merely clicking and opening it. Accidentally also, while you're browsing through your inbox, scrolling down, scrolling up, and suddenly you might have accidentally pushed that button or clicked that. Even then, it gives you the data. And then how much time did you actually spend on screen to read it? And in that email, there may be links. Did you click that? So that precision and brevity is also being collected. And then that is stored. No wonder one fine day you get a call from Policy Bazaar And they say that, okay, and how, you wonder that how do you actually get a call from them? You've never given your phone number. Then your phone number, which is linked to your Facebook account, and your Facebook is also on while you're browsing your Gmail, that might also go to them. So it's a superlative, analytics that is going in deeply into it. So every now and then when you get this spurious calls, cold calls, or people who are just trying to target, they're not just trying to target. They know for sure somewhere or the other you clicked it. You clicked because you wanted to know about insurance, health insurance, medical insurance. And then you were interested in specific things like top up in the medical insurance. I have 5 lakhs sum assured, but I want to enhance it. Is there a way that I can pay more premium to the existing ones and then go to the next one? Can that be possible? That's another way. So we have gone into this precision-based, data-driven things. It's good or bad, we are not discussing right now. We will talk about it when we come to the ethical part of it. There are lots of ethics when it comes to data. Why are they troubling you? Did you give them your consent? Why are they even calling you? Who has authorized them to call you? Why should they call you? You may be busy and you don't want to really, or you may be interested. You want someone to call you and educate you that there exists such and such policy, and through that you will be able to get benefit. That's what they are. And the third one, if you look at it, is the data analytics that has emerged as a promising tool for solving problems. There are a lot of problems that you can resolve it. Many problems. Micro to macro, primary to secondary, all databases, all data types, all data sources. The whole idea through the data and analytics is to solve. Problem solving is what we are. So why do 5 to 6,000 patients visit KIMS? Because they have a problem, or their kith and kin has problems. Their loved ones have problems. There may be some acute diseases to chronic diseases that they are into it. Variety of reasons, different types and different kinds of problems. That's why we are there. Okay, let's move on. So this, since it's a beginning, and also I don't want to really sound too theoretical in nature, at the same time too jarring, too blurry, but I want to sound more like these are the things that are happening already. We may not be aware, but the hospitals are already doing it. You may not be party to it, but your hospital may be party to it. You may not have hands-on experience, but your hospital is already doing it behind the doors, behind the curtain. So let's look at some of the challenges and opportunities in healthcare analytics. What are they? First and the foremost thing is the healthcare is an interdisciplinary field. What is interdisciplinary? What is this term called interdisciplinary? Anybody? While I take a pause, go ahead. Are you all there? Yes, ladies and gentlemen, doctors and healthcare. Yes. So tell me, what is this interdisciplinary? Why healthcare is an interdisciplinary suddenly? You will not just get data from the doctors and professionals, but you also get it from psychologists, sir. You will also get from sociologists. You will also get from technocrats. You will also get to know from the government agencies. And you will be able to create those databases. What is data mining? You heard of this term? How do you mine the data?
All the data is stored in the databases.
Okay, all right, that's good. Okay, so how old is KIMS? What is the age of KIMS? When was KIMS born? Which birthday that you're celebrating?
It's
Anybody? $20, 30 years, 40 years, 50 years? How many years?
20 years, sir.
20 years. Okay. So in the last 20 years, you have got various databases of people who have come for problem solving and their problems are solved. How do you get their details? In order to get those details, you have to do a thing called data mining. As you mine, how do you get minerals? How do you get metals? How do you really go and get them? How do you get coal, diamonds, gold, silver, copper, bauxite? Same way you're going to do the data mining. So the existing databases, you have to go and mine it. You have to extract it. That extraction is an important activity today. It's not easy to get it. Isn't it? Tons of data. It's very difficult to pull out. It's like finding a needle in the grass hay or in the heap of the grass. It's so tough. You have it, but you have to get it. Just because I have it, it doesn't mean anything. I have so many things at my home, my books, but that particular book, when I needed it, I won't get it. That's a bad data mining. So what is the fun of having that book and when I needed it, I don't get it? And human capacity has limitations and hence I will fail. I fail in my endeavor. I end up searching and searching and searching and then there is no result. That is why data mining is an important tool. And then we have to do a lot of medical research. There are so many advancements that are happening in the medical science. And then there is a new science that talks about cervical spondylitis to cervical cancer. And there is this another important thing people have spoken about is that cancer and women, cancer has a gender relationship. There is a new study why there are more often and more women who are prone to the cancer than men. So the medical science is trying to find out the reason and you will get the data from it. So what are the samples and what are the populations that you have actually seen it? Or is it happening only in the middle class and upper middle class, whereas the poor or the lower middle class is spared from it? The lower middle class women do not get cancer, it's the upper middle class. Is there a class angle to the gender as well? That kind of medical research. Then of course it's a wedding, it's a alliance between medical professionals and also the computer scientists. So computer scientists are not trained in the medical concept, they don't know an ABCD of it. How do you know what is the average temperature? When do you call somebody has a fever? When you say someone has a high BP? What are these standards? What are these statistics? I know how to compute, but I don't know the entirety of it. When you say someone is diabetic, what is the concept? So the medical concept is to be taught to the computer scientists. So the scientists are able to provide the tools and techniques. They will be helping you and making your life easier, but will you be able to understand it? So, and the medical professionals and researchers have limited exposure to data analytics. So this is a great opportunity. Medical scientists, like all of you, are here more or less into the healthcare profession, and then you have decided to make careers. So you know in and out about the medical terminology. The moment anybody uses that terminology, then obviously you will realize it. But you may not be so good at data mining or data analysis or data analytical tools. You may be good in medical research, but the technology that you're going to use will not be of much importance to you. So can there be a bridge between the two? How do you create that bridge? That's why the healthcare analytics presents an opportunity for the adoption of the new computing technologies. So if you are shying away and going drifted from the computers and the technology or the technological innovations and tools, then probably you have to take a call. You have to decide. It's not simple, but please do not shy away from embracing the technology. All medical professionals should and must have exposure to the technological tools. That's a basic requisite today. And hence it's no wonder that in the MBA healthcare management, you have a subject called healthcare analytics. Healthcare analytics is to bridge the gap between healthcare professionals and the computer technologies. So you're trying to match them up. That's why you are here and they are being introduced. Okay, any questions that you have? Anything that you feel like asking? So what are we done in this 12 sessions? In these 12 sessions of the 12, this is the one of the 12 sessions. So this is the first session, so it's important for me to cover range of healthcare topics, and that is exhaustively. Like what are the different kinds of contribution from the industry and from the academia. Academia and industry, they are two parallel worlds, and these two worlds may or may not meet, but they should complement each other. They contribute, but they may not meet. They are like the parallel tracks on the railway. So if they meet, that's the best journey that you can have. Because right now this is the academic activity. MBA is an academic activity, whereas hospital is a practical industrial field. So what you learn in this course may or may not be applicable in your field, in your industry. So that's why relevance or the relevancy of the syllabus and the content is of primary importance. That is why you have to look up to it. So this is not merely a theoretical course, but this is also going to be a hands-on practical course as well. That's why. And then if you look at the healthcare data analytics, it involves identifying data points using basic analytical techniques to solve the healthcare problems. I think most of them would begin with the HR or the Excel, and then probably you may be able to use it the MS Access also. These two are quite handy because they are also available most of the times along with the computer that you have bought or the laptop that you have. So any word processing, any Excel sheet, spreadsheet, and MS Access will give you idea into it. So you'll be able to learn about that, right? So there are a lot of applications of the healthcare analytics. So it can help you to improve. But why are we using them? The moment you go, the doctor will put a thermometer and take the reading and then put a belt to check your BP. He or she or the nurse or the healthcare professional, they are just trying to collect the data of the patient. You say that I have palpitation of the heart. I have my breathing going up. I'm unable to breathe. So they immediately check your blood pressure. I think blood pressure is an important way to look at it. And improving the health and well-being is of primary importance. Without numbers, it's very difficult. Earlier doctors used to just check the pulse and say it. But today's doctor, it is impossible to find a person who is not going to look at the numbers. The moment you go to him, he will check the numbers. And the numbers are generated from you. The numbers are telling more about you. They are not sounding different. So this course is going to provide you that unique perspective on the healthcare data, especially about the opportunities for the adoption of the new technologies, new computing technologies per se. That's why we are looking at it. So what is the impact that you will have it? You will have a great impact. You will have not just but you will feel comfortable. First and the foremost thing, that whole fear psychosis, that fear of the numbers, fear of data analysis, fear of doing statistical tools, testing, all that will go in vain. A lot of diagnostic tests are conducted, right? So of this 5 to 6,000 patients, like our friend Sai mentioned or Santosh mentioned, uh, half of them might also go for diagnostic tests. So if you give samples of your blood, urine, and they will be doing or conducting sample tests, and these tests will give you results. They will tell you whether there is a sugar in your blood or not. What is the insulin going to be? Are you insulin resistant person, or you are at the borderline? So those impact will go a long way. And then this is also about the comprehensive discussion that we want to have it about the compendium to students, researchers, and practitioners. I consider all of you are as healthcare researchers, because you may be sitting in the hospital doing collecting, assisting doctors or taking care of them, or many of you are also doctors and you have access to many of the patients, and then it's it's a very organic cycle that we have created between and among the stakeholders of the healthcare system. The stakeholders like the doctors, patients, paramedics, then the infrastructure, hospitals, government, caregivers like parents, attendants, all of them. They are the ones. Who are the people usually accompanying patients? Can we do a study on the impact of the patients or the impact of the presence of the attendants in taking care of the patients? So I am a patient. I have nobody who has come with me when I'm hospitalized. So I'm all alone. Versus I have just beside me a neighbor who has come along with the mother. So mother's presence to the patient will have a greater impact than someone who doesn't have it. So look at the relationship that we are trying to understand. So there is a causal relationship that is happening. So that relationship is indeed an important. I'm just throwing some, a random thought into the air, and I urge you and also request you to give a deeper look into it. You must have come across, or sometimes there are lots of attendants who would like to come. There are also people who like to visit the patient. Visitors visiting the patient versus no visitor visiting the patient. In both ways, is it going to impact the health of the patient? If you have the data, then you can decide. And what is the percentage of time that the patient is visited? 5 minutes, 10 minutes? That's why you have maximum limit. You say that beyond this time, the patient visiting hours is not allowed. You say that it will have an adverse impact. How did you create that rule of visiting hours? It's not 24/7 that you allow visitors. You say that this is the time in the evening you're allowed to come and see your patient, talk to him or her. So how did you zero it down? Again, data. So data health care analytics is an integral part of that. All right. So overall, how analytics is transforming healthcare and improving patient outcomes is our concern. The outcomes are the concerns of the corporate hospitals also. Because why are they investing hundreds of crores into it? There is some financial gain that they want to do it by providing finest health. And that cannot be done without the computing technologies. Okay, so we will stop it here. It's already 7:30 and I don't want to drag it. Tomorrow we'll meet with